Hi, my name is Jade Cohen. My pronouns are she, her, and I am a fourth-year medical student at the University of Minnesota Medical School. Today, I'm very excited to be talking about breast cancer in transmasculine people after gender-affirming top surgery. And here and in general, transmasculine will be used to refer to trans men, non-binary and gender non-conforming people whose gender falls more on the masculine than the feminine side of the gender spectrum. So when we talk about gender-affirming top surgery, we are talking about a surgery that changes the external appearance of the chest to be more masculine, to be more in line with someone's internal gender identity. And so we've got some pictures of technique at the right side of the screen. By far, the most common is that double incision technique up at the top. And top surgery is the most commonly wanted and received procedure by transmasculine people. And they are becoming more common in number than gender-affirming surgeries for trans feminine people. So when we talk about trans healthcare, a lot of times what gets stressed is the interventions, such as hormone therapy and surgeries, as previously mentioned. But preventative healthcare is also very important. And so when we approach treating trans and gender nonconforming patients, we like to sort of say, treat the parts they have, don't treat the parts they don't. So think of it that way. So when we're talking about a chest surgery that removes chest tissue, obviously breast cancer screening is a good concern to think about. And so most surgeons will have their patients undergo preoperative imaging, pictures of the chest before the surgery, just to see what's in there, just to see if there is anything that is concerning for cancer. And the mean age at the time of top surgery is 29, which is much younger than the median age of breast cancer development in the US woman, which is about 62, but it is still an important consideration. And so the thing is that breast cancer screening guidelines for cisgender women are based on a lot of data, based on data from millions of women over the past several decades. And those recommendations are that they get mammograms annually, starting between ages of 40 to 50, depending on the organization whose guideline you're reading. And the thing is that for transmasculine people, breast cancer screening recommendations, well, there's just not enough data to support the same quality of guidelines. So instead, what we have are expert opinions that have been put together by some very smart doctors in places like California and Boston. And so what they recommend is that transmasculine people be screened for breast cancer based on the parts that they have. So if all of the chest tissue has been taken out, you probably don't need imaging every year, and a chest exam by your physician is okay. If you still have chest tissue, if you haven't had any surgery, or if you've had a surgery that is more like a breast reduction where there is still a significant amount of tissue remaining, then that patient should be treated like a cisgender woman and follow the recommendations previously stated. And what we are looking at are records from all the people at the U, patients at the U who received top surgery in the past 10 years to see if we did have any cases of cancer, either at the time of surgery or after. And our hope is that if we identify these, they can add to a very small amount of data on transmasculine people who had breast cancer. Overall, in the medical literature, only 33 cases have ever been identified. Thank you so much for listening to this talk.